Good day everyone, I'm Narisa Di Silva and we're gonna talk about blood pressure. Blood pressure is the force of blood pushing against the wall of your arteries. It is taken to help us identify if we are at risk of heart disease or stroke. Normal BP for most adults is defined as systolic less than 120 and diastolic of less than 80. And this is the normal range of BP according to age for infant to adolescent. Taking your BP has many purposes. To obtain baseline data, to compare subsequent changes occur, to assist patients a status of blood volume cardiac output, to evaluate changes of physical condition of a patient. There are different ways in taking your BP. One is using your pointer finger and middle finger put in your brachial artery to palpate. But this moment, I'm going to use auscultatory method. Auscultatory method is by using the stethoscope. And the other equipment we will use is the sphygmomanometer. Stethoscope and its parts. Sphygmomanometer and its parts. First, always maintain hand sanitation by washing it with soap and water, or you can use alcohol-based sanitation. Make sure also that the equipment you use is properly clean and sanitized. Assist the client to a sitting position. Check client's identification and explain the purpose why you're taking this test to me. What's your name?
I'm Alvin Nuevo.
How about your age?
I am 47 years old.
Okay, I'm just taking your BP, so just sit down and relax, okay?
Okay.
Support the selected arm. Turn the palm upward. Remove all the constrictive clothing to access the pulse easily. Check the brachial artery and wrap the cup. Center the cup's bladder appropriately 1 inch above the site where you palpated brachial pulse. Appropriate way to wrap the cup is that you can put only 2 fingers between the arm and cup. In that way, we can secure the right reading because loose fitting cup causes false high reading. Position your stethoscope earpiece comfortably in your ears. Turn tip slightly forward to the diaphragm to make sure sounds are clear. And then, place it with the brachial artery. Close the screw and then you can start inflating the cup. Inflating the cup to a pressure of 140 for adults. Until the pulse heard disappear. Open the clamp and allow the aneroid dial to fall down at the rate of 2 to 3 mm of mercury per second. Doing this, note that the point on the dial when first clear sound is heard and that sound represents systolic pressure. Continue inflating the cup and note that the point where the sound disappeared, listen for the last sound and that is the diastolic pressure. Release the remaining air quickly and remove it. Wash your hands again and now you can advise your client about the reading you measure. If you are going to recheck the reading for any reason, allow 1 minute interval before taking it again. Your blood pressure is considered stage 1 high if it reads 130 over 80, or stage 2 high if it reads 140 over 98. But if your blood pressure is reading 180 over 110 or higher right away, immediately seek for medical treatment. Here are some good tips to naturally lower your BP. Exercise regularly. Eat healthy diet food. Reduce sodium in your food. Limit the amount of alcohol you drink and quit smoking. Cut back on caffeine and reduce your stress. So that's it, guys. Thank you for watching and hoping you've learned so much about blood pressure. Have a good day, guys.